One of my roles here at the Alliance is to develop a framework for ending homelessness through state government and state-level systems. There are many ways that decisions and indecisions in states can have an impact on communities working to end homelessness. Some approaches are more promising than others, and there are a lot of variables to determine which way to go. Do you have the right state leadership at this time? What's the fiscal picture in your state? What are your priorities? What is your starting point in housing capacity, services, community collaboration, and so on? Our goal is ending homelessness. The Alliance is striving to identify state policies and programs with the most potential impact, and we want to help you identify the most productive policy routes for you to take where you are. Fortunately, we can rely on experts who have found opportunities and engaged in their states. I'm very excited that this webinar will feature two different perspectives from two very different states. Sharon Rapport, who will speak first, will focus on state legislative efforts in California, one ongoing campaign in particular. Sharon is CSH's Associate Director for California Policy. She has been working on a range of state options to help end homelessness in California, including Senate S391, which she will tell us more about. Sharon also has federal advocacy experience and is a great partner with the Alliance in that. After Sharon's presentation, we will hear from Pam Kestner and Kathy Robertson, who are guiding communities in Virginia implementing a state initiative on rapid rehousing. Pam is the Homeless Outcomes Coordinator for the Commonwealth of Virginia, and we love that title, Outcomes Coordinator. She was appointed to this role by Governor Bob McDonnell and serves in the Office of the Secretary of Health and Human Resources, which is partnering with the Office of the Secretary of Commerce and Trade to address the issue of homelessness in Virginia. Kathy Robertson works at the state level also and is now assisting with the Homeless Outcomes Coordinating Council. Besides that, she is Associate Director of Homeless and Special Needs Housing for the Virginia Department of Housing and Community Development. I know you will learn a lot, and our presenters will leave you with concrete ideas about what you can advocate for in your state with your collaborative partners in ending homelessness. A couple of housekeeping items before we begin. First, we will have some time for your questions at the end of both presentations. Please use the questions feature on the right side of the webinar screen. Go ahead and type in your questions. On our end, my colleague Anna Blasco is going to keep an eye on that space, and when the time comes, she will field questions to our speakers. We'll try to answer your questions as time allows during the hour. If we run out of time, we'll make every effort to respond offline. Second, we are recording the webinar, and we'll post the recording along with the presentations on our website, and we'll let you know when those are available later in the week. Finally, technology being what it is, you might experience a bit of a lag time switching presentations from speaker to speaker. Usually it takes a few seconds. Now then, let me turn things over to Sharon Rapport in California.
Hi, everybody. I'm just going to queue up my screen here, and hopefully everybody can see it. As Lisa mentioned, I'm Sharon Rapport, and I work on state policy for CSH in California. CSH is a national organization with the mission of advancing housing solutions that deliver three powerful outcomes: improve lives for the most vulnerable people, maximize public resources, and build strong, healthy communities across the country. So we have, I think, our largest presence in California with 3 hub offices in the state. We have been working on state policy. I've been working for CSH for a little over 7 years, and we've been working to influence state policy for the last 15 to 20 years. We've created relationships in both our state legislature and at state agencies that have resulted in proven results. Though I'm currently the only lobbyist in Sacramento working to influence state policy on homelessness, this year we succeeded in passing 2 bills that became somewhat high profile for our state. The first bill taps into an Affordable Care Act option to fund services and housing. The other will allow voters to repurpose housing bonds now used for home ownership for veterans into a program creating rental housing for homeless and other low-income veterans. These are not the topic for today's webinar, But if you do have questions about either of these bills or other work that CSH does in California, please feel free to contact me. So just a little bit of background about homelessness in California. We have the largest homeless population in the nation, with about 21% of all homeless people living in California. We also have a growing population of people experiencing chronic homelessness. We actually, last year, had 1/3 of all chronically homeless people living in California. We have a pretty large supply of supportive housing compared to other states. But though we've had a lot of supportive housing development in California, most of our supportive housing has not been used to target people experiencing chronic homelessness. So while other populations of people experiencing homelessness have been decreasing in California, our population of people experiencing chronic homelessness has actually been increasing. We have had a pretty rich array of sources of funding for capital development in California over the last 20 years compared to other states. But over the last 3 years, our governor and legislature eliminated all redevelopment revenue for affordable housing development. At the same time, our home and CDBG dollars have been greatly diminished, as has happened in most other states. We had state bond funds that were used for affordable housing development, and they have been all depleted. By the end of this year, they will be gone. And finally, we had a source of funding through our Mental Health Services Act program that included a one-time allocation of $400 million to create supportive housing for people with serious mental illness. That money has been largely depleted and will be gone most likely next year. So that has left very few funding sources for capital development. And in general, as with most of the country, I think, we have seen a huge decrease in funding for rental housing. California has seen a 40% loss in federal funding and a 90% loss in state funding for affordable rental homes over the last 3 years. The trend is getting worse, not better, for the foreseeable future. Our state budget has never included more than 0.5% for housing in the past, but now we'll have no funding for state money for affordable rental housing by the beginning of next year. I don't know what's going on with my screen. It seems to have gone a little crazy. I apologize. So I'm going to be talking today about SB 391. It's Senate Bill 391. This year, Senate Bill 391 was introduced to create a dedicated source of money to generate $500 million each year to create affordable places to live in California. And it's referred to as the California Homes and Jobs Act. Most of you who are on this call probably have Affordable Housing Trust Fund. As you can see from this map, almost every state in the union has an Affordable Housing Trust Fund. Ours is one of a handful of states that do not have funding for our Affordable Housing Trust Fund at this point. 21 states rely on a document recording fee to fund their trust fund. And so for over a decade, I think it's been about 15 years, affordable housing advocates have been discussing a dedicated source of revenue to fund our Affordable Housing Trust Fund. And there are a couple of reasons why. We really felt like we needed a dedicated source of funding so that we could have a sustainable source of funding that would not be subject to our state's budget and the booms and busts of our economy. We settled on a document recording fee because we thought that this recording fee would bring in enough money to generate a significant number of new jobs in the construction industry every year. We also felt like that funding source we'd be able to leverage a big chunk of money, federal, local, and private sources of funding for affordable housing creation. And of course, the ultimate goal of the fund would be to create tens of thousands of new affordable places to live each year. And we do expect that the fund would generate about 10,000 households living in affordable homes every year. So as I mentioned, the Affordable Housing Trust Fund would help generate more funding for capital, but it would also generate funding that could be used. It would be a flexible funding source that could be used for operating subsidies as well as operating costs of capital development, and then finally services and housing for outreach and for innovation. So as I mentioned, the source of the funding would be a real estate document recording, and it would exclude home sales from that recording fee. So there would be three main sources of revenue that would remain. The first would be documents that developers have to record when they're building. And because developers are benefiting from the bill, they're in large support of the bill. The second source of funding would be banks. They would actually have to pay a significant amount of money in recording foreclosure documents. On the other hand, banks have a big role because of their CRA requirements in investing in community development. So banks would benefit in allowing them to invest in community development more widely in California. So the banking industry is neutral on this bill. They are not opposing it, and they're not supporting it. Finally, the other source of funding, the other main source of funding would be in refinancing, homeownership refinancing. And the basic requirements of a refi in California is that two documents have to be recorded. So for a refi on a house, it would typically require $150 in real estate transactions to record these two documents. In California, the typical homeowner refinancing their home saves an average of $320 a month when they refi. So we really feel like these two documents that need to be recorded would be made up for in the savings in refinancing their home. So the status of the bill right now is it has, in California, we require a 2/3 vote in each house of our legislature to pass a bill that implements a new fee. SB 391 has passed the Senate with that 2/3 majority. It has also passed 2 Assembly policy committees and is now pending in the Assembly Appropriations Committee. It was introduced at the beginning of this year, and it has 2 years to pass. It has during our 2-year legislative cycle. It has to pass the Assembly Appropriations Committee before it can head to the floor of the Assembly, and then it has to pass the Assembly floor by a 2/3 vote, or 54 votes in our Assembly. If it passes the state Assembly, it would then head to the governor's desk, and the governor would have to sign it before it would become law. Unfortunately, our governor is not entirely friendly to affordable housing development, and so we have a lot of work to convince him, as well as our Assembly members, that this bill is a critical bill that must be passed. So because of this 2/3 vote threshold, we have done quite a bit of work to mobilize not just the housing sector or the sector of homeless service providers, but all of these types of sectors that are listed on your screen: healthcare, business, labor, cities, United Ways, police and sheriffs, veterans groups. And as I mentioned, several cities are in support. Some of the bigger cities like the city of Los Angeles and the city of San Francisco are in support, as well as housing providers and service providers. And there are many, many other sectors that are represented in our list of supporters. It does have a handful of opponents, but the most powerful among these opponents is the California Association of Realtors. Even though realtors would not be impacted by the document recording fee, as I mentioned, home sales are excluded from the document recording fee in the bill. Realtors are opposed simply because they oppose any fee on real estate transactions. Interestingly, though, they did support last year's bill, which was the same as this year's bill. So we have done a number of efforts to register support. Excuse me. The first is a postcard campaign that tenants living in supportive housing have been very active in. The campaign has been asking tenants to sign postcards and then send those postcards to the legislature, to their legislators and to the governor. We are also asking every organization who has any relationship at all in preventing and ending homelessness to sign this endorsement form and then to send a letter to their legislators and the governor in support of the bill. So we've had a pretty, as I mentioned, a pretty broad coalition. 2 organizations are sponsoring the bill, Housing California and the California Housing Consortium, and they work closely with Senator Tsanye, who's the author of the bill, to shape the bill. But there's also, in addition to those 2 sponsors, there's a team of lobbyists in Sacramento that have been working to pass the bill. There's also a communications team that's been working on messaging the bill and getting the bill press coverage, and it's become quite a controversial bill, both because of that press coverage and because of the nature of a new fee. In addition, there are regional nonprofit housing organizations that are working closely with regional coalitions to target specific legislators. And as I mentioned, tenants are heavily engaged in sending postcards to both their legislators and the governor. Tenants have also been involved in coming to the Capitol and lobbying for the bill in Sacramento. And in our state, that's no easy task, since usually that involves a plane trip and sometimes a hotel stay. So though we've been involved in this broad coalition, some of the partnerships that have been included in the coalition are not our typical partnerships. We don't usually partner with the Building Industry Association, for example. And the key to all of our work has been relationships with Capitol staff, legislators, and agency staff through all of our efforts, including the 2 bills that I mentioned at the beginning. Because of these relationships, the amendments that have been taken on the bill since the bill has been introduced have been largely homeless-focused. The bill originally listed eligible uses of the funds, but it did not include a list or a breakdown of how the funds would be used. For example, it did not say that 30 or 40% of the money had to go toward efforts preventing and ending homelessness. So the amendments that were added a few months ago requires the state to conduct a 5-year strategic plan. And the legislators who introduced these amendments listed what must be considered in that strategic plan. There is a big emphasis on homelessness and innovations to prevent and end homelessness in those amendments. And that is simply because we've had good relationships with Capitol staff for a long time that have allowed us to make some inroads in how the bill should be shaped. And it's also allowed us to work closely with the bill sponsors to make sure that the amendments that the sponsors were amenable to the amendments and that our coalition of partners were amenable to the amendments. Interestingly enough, even though, as I mentioned, I'm the only lobbyist in Sacramento working specifically on homelessness at the moment, some of the industry partners in the coalition have protested that some of the amendments taken had too much emphasis on homelessness. So I think because of our relationships, we've really been able to to ensure that the bill does address homelessness in its final form. And finally, I'll look forward to answering your questions. Thank you.
Thank you, Sharon. And we are now going to come across the country and hear from Kathy and Pam in Virginia.
Okay, thank you, Lisa. Can you all hear us and see the screen? It should read Resetting State Priorities.
I see your screen and I can hear you.
Terrific, terrific. Well, thank you again. My name, as Lisa mentioned earlier, is Pam Kestner. I serve as the Homeless Outcomes Coordinator for the Commonwealth, and I like the title, too, because it is focused on outcomes, and that's what we want to see here in Virginia, and as Kathy will mention a little bit later, we're seeing some great progress here in Virginia. The first step in all of this was something that Lisa had mentioned earlier about the right state leadership. We are very fortunate when Governor Bob McDonnell first came into office back in 2010, he issued Executive Order 10, which created a housing policy framework for the executive branch, which was the first time this has occurred in Virginia. And basically the purpose of the housing policy framework was to establish broad goals and policy direction related to housing, as well as looking at coordinating comprehensive and effective housing policy among other public policy areas and initiatives dealing with several different secretariats within the executive branch. Within the housing policy framework was a focus on homelessness. Governor McDonnell turned to his senior economic advisor, Bob Sled, to spearhead the focus on homelessness within the executive branch. And Bob Sled turned to Secretary of Health and Human Resources, Dr. Bill Hazel, to assist him in this effort to ensure that this was a collaborative approach, Bob Sled being within the Secretary of Commerce and Trade, and Dr. Hazel being within the Secretariat of Health and Human Resources, because those are the two key secretariats involved in homelessness. However, within this Homeless Outcomes Advisory Committee that they developed, they also included representatives from public safety, veterans, and so forth. So we really had a multi-agency, multi-secretariat approach to addressing homelessness in Virginia. The advisory committee began meeting in the summer of 2010, and within 4 short months, they published a report that identified outcomes and an overall goal to reduce homelessness in Virginia by 15% by the end of Governor McDonnell's term, which is coming up in just a couple of months. So the advisory committee identified that overall goal, but in order to achieve the goal, determined that there were several strategies that needed to be implemented in order to reach the overall goal of reducing homelessness by 15%. You see on the screen there are 5 strategies, and I won't read them all, but just briefly touch on increasing permanent supportive housing, shifting funds to prevent and support rapid rehousing, increasing statewide data collection and system coordination, increasing access to substance abuse and mental health, and then improving discharge policies within the foster care system, but also in prisons, jails, and hospitals. And I want to spend just a couple of minutes talking about system coordination. One of the action steps that the report identified was creating a coordinating council that would be comprised of members from the various secretariats I mentioned earlier, various state agencies, and some nonprofits, representatives from a continuum of care in the state, as well as some planning agencies. This was key in the advisory committee's thought was that we really needed to have an oversight group to ensure that the plan was implemented, because we all know once you create a plan, you have to keep it in front of everyone in order to make it real in order to implement it. So both Bob Sled and Secretary Hazel co-chair the Coordinating Council, which has been meeting on a quarterly basis over the past several years. As a part of the strategies, you'll see the second bullet, the increased flexibility of funding to prevent homelessness and support rapid rehousing. This was a real major shift for Virginia. Kathy's going to talk more specifically about how this occurred. But as you all know, within making any type of system transformation, you need to have all parts of the system on board. And having the governor and the executive branch playing key leadership role, you also need the key state agency that funnels funds to the homelessness service providers across the state on board and having the same vision for ending homelessness. So Kathy will now talk about what the Department of Housing and Community Development has done over the past several years.
Thanks, Pam. As Pam mentioned, we truly were in a system transformation mode, moving from a reactive to a proactive approach of dealing with housing crises. Also, as Pam mentioned, we had the leadership at the state level with Governor McDonnell and Bob Sled. We had the coordinating council in place. It seemed that the stars were truly aligned. In addition to all the support on the state level, there was the push on the federal level from HUD with the HEART Act. And then, of course, there were some of the higher capacity COCs already shifting priorities and working more collaboratively to address the issues. And so on both the state and the federal level, we were moving from programs to systems, from activities to outcomes, and changing the focus from that of shelters to prevention and rapid rehousing. But in order for the system transformation, in order for this to really be successful, we had to change both the resources and the practices. So, as Pam mentioned, all of the funding for homeless programs funnels through the Department of Housing and Community Development. And we actually started making changes some time back. We started back in 2008. And at that point in time, we were allocating resources for both the state funding that we had for homeless programs as well as the federal funding with ESG. We were actually allocating that on a per bed basis. But so we started tweaking that formula slowly but surely. We started tweaking that to include the utilization rates, you know, how full were the shelters, as well as adding a level of supportive services. You know, was there proper case management and that sort of thing. And so we started tweaking that formula over the years until we finally moved to a competitive application. Then during that time frame, of course, there was also HPRP in 2009. And so we, you know, learned a lot from that as well about rapid rehousing. So there was a national movement to rapid rehousing. There was a state movement to rapid rehousing, and of course, because it's more cost effective and it serves more people, because if it's more cost effective, you are able to serve more people. But as I just mentioned, in order to really be successful, you have to change not only the practices, but the resources as well. And so this chart talks about how our funds have shifted over the last 4 years. The top line, the blue line, you can see that the resources for state resources have remained relatively level. There was actually a boost in FY13 of $500,000. That was an additional allocation, an additional appropriation that was added specifically for rapid rehousing, and that remained level in FY14. We kept that. But so the resources have remained relatively level. But if you look at the bottom line, the red line, in FY11 we had 4 little pilot projects out there doing some transition in place model rapid rehousing, and it was about, we had redirected about $350,000 for these organizations to do that. Then in FY12, the coordinating council had set out the advisory committee had set out these strategies. Everything was moving in this direction. So we redirected $1 million, again, wanting to move things gradually and getting people used to just getting buy-in from the communities and from the providers. We redirected $1 million through a competitive application project and funded 21 organizations with rapid rehousing projects. Then in FY13 was the major boost. That was when we did a competitive application and prioritized rapid rehousing through that competitive application process. And you can see that we jumped from having about $1.3 million in rapid rehousing activities to having over $4 million in rapid rehousing activities. The reason it has not gone up even more in FY14 is this is a renewal year. We do 2-year grants, so that's just a renewal grant, a renewal year, but it did go up some. So some people continued to shift funding even more. Likewise, the number of organizations that were providing rapid rehousing grew tremendously. We started out in FY11 with 4 organizations, then in FY12 those 4 plus the 21 others through the redirected $1 million. Then again in FY13 through the competitive application process, a total of 62 organizations providing rapid rehousing, and now over 68 organizations providing rapid rehousing. Sorry, just a little glitch there. Okay, so looking at the picture now, where are we in FY14? As I just said, we have 68 organizations doing some rapid rehousing activity. 65% of the state funding is for rapid rehousing activities. It was less than 20% just 2 years ago. And this year, there's $4.6 million in rapid rehousing. Likewise, with the Emergency Solutions Grant, up until ESG Stage 2 came into play last year, all of our ESG funding was for shelter ops. We did not do prevention, but with Stage 2, we added on prevention and, of course, rapid rehousing. Actually, we added prevention the year earlier. But currently, 29% of the ESG funding is for shelter ops, 22% for prevention, and 49% for rapid rehousing. Of course, part of this transformation also included a huge training effort. Like I said, we wanted to do things gradually, so we moved the money gradually. We tweaked, we first tweaked the formula, then went to a competitive application. But we also, again, the stars were aligned, and the Freddie Mac Foundation saw what being located in Virginia. They saw what Virginia was doing with the housing policy and wanted to become involved in those efforts. So they actually awarded the National Alliance a grant, $1 million grant. We're at the end of year 2 with that grant, and it's a collaborative effort with the National Alliance to End Homelessness, the Virginia Coalition to End Homelessness, and the Commonwealth, and again funded through Freddie Mac. And what that has allowed us to do is primarily help people move to the rapid rehousing workshop. Through to the rapid rehousing model. In year 1 of the grant, the Alliance did workshops throughout the state. We also did some grants to help people move to that model. This particular initiative was about reducing family homelessness in Virginia, but obviously what works with rapid rehousing for families also works with individuals. So we were, this has been a huge part of our ability to help transform the system, is because we have helped people move there. And our impact has been significant. If you recall, Pam said that the goal was to reduce homelessness by 15% by 2013 by the end of Governor McDonnell's administration. Well, actually, by the point in time count this January, in January of 13, overall homelessness had reduced 16%. Family homelessness had reduced 17%. And then, as you can see, the different subpopulations have reduced as well. So, in summary, what we've tried to do is move from funding organizations to funding programs, and then moving from a focus on programs to a focus on outcomes. And this year, actually last year, for our federal funding, we introduced, we did our awards for funding very differently. We had communities submit a COC application, and we wanted to ensure that people are using their funding as effectively and as efficiently as possible, and that they are looking at everything on a community-wide basis. And this coming year, we will look to do all of our funding in a combined application that will be, again, a COC application, and we, DHCD, will continue to contract with organizations individually so that we maintain monitoring and that sort of thing. But community COCs will present a proposal to us on a community basis. So if we're ready for questions.
Okay, well, thank you, Pam and Kathy. And I'm going to ask Anna now if she's got questions coming in through the question line.
Sure. So if you have questions, please type them into the chat box now. It looks like we do have one question for Sharon. If you could talk a little bit about how SB 391 is related to the California Initiative or Strategic Plan to End Homelessness. How have those initiatives been connected?
They really have not been connected. The Plan to End Homelessness was adopted a few years ago, but it really has not been implemented. So even though the state officially adopted the plan, we really do not have a working, living plan to end homelessness in California. SB 391, therefore, doesn't really touch on that plan. Clearly, the plan called for increases in resources, though, and I think we are hopeful that SB 391 will produce increased resources for housing. And as I said, it's a flexible source of funding. So even though some of the money will go toward capital development, there'll be other funds that will be targeted to operating subsidies and things like rapid rehousing programs that Kathy and had mentioned as well.
Thank you.
Yeah, hi, and this is Lisa, and I do have a couple of questions, too, if this is a good time, Anna, while we wait to get some other questions in the queue. And this question is for Sharon, and it is kind of prompted by Kathy and Pam talking about really the efforts they've put into implementation once they had a policy shift. And though you're dealing with a very different policy avenue through a big piece of legislation, I'm just wondering what you see as the implementation challenges. Let's say that the bill passes and it's signed and administratively and bureaucratically implemented, but what kind of challenges do you see for directing resources to ending homelessness, and how, as an advocate, would you prepare for that?
That's a really good question, Lisa. So I think the biggest challenge is actually going to be this huge group of supporters of the bill. As I mentioned, we have a big list of supporters, and some of them are pretty powerful in the Capitol, including the Building Industry Association. And one of the bill sponsors, California Housing Consortium, also does not have an emphasis on homelessness at all. So there are a lot of competing interests who have been working on the bill to bolster their own sector, their own members. And it's, I think, going to be very difficult to have a voice that's loud enough in that conversation among these big players that typically do have a lot of power in the Capitol. So I think most likely what we will have to do is, again, build on the relationships that we've established over the years to make sure that a significant chunk of the resources go toward preventing and ending homelessness. And I think that there is going to be great temptation to put all the money into capital development and maybe target populations that are maybe a little bit more politically attractive. Home ownership is one that I think will be a politically attractive source of funding or use of funding when the bill passes. And so I think we're just probably going to have to make sure that those relationships that we've built pay off, and that those working to prevent and end homelessness have a voice that's heard on how the money should be used. So in my mind, that will be the biggest challenge going forward.
Right. Well, thank you. And actually, just to turn the table a little bit in Virginia, I'll ask the other side of that question to Kathy and Pam, and that is if you had public or legislative champions before the governor made his decisions and established a budgeting approach that really embraced rapid rehousing. What was the climate in preparing providers and other stakeholders ahead of time?
Sure. We've been fortunate that we have a couple of statewide groups, nonprofits, that do some advocacy at the state level. Kathy mentioned one that we're partnering with, the Virginia Coalition to End Homelessness, as well as the Virginia Housing Coalition. They have joined forces over the past several years to support Governor McDonnell's proposed budget, as well as when funds were not included, the coalition submitted a budget bill amendment and was able to garner a lot of support from various groups around the state. So obviously, as state employees, Kathy and I can't advocate for budget bill amendments, but it's really key when making change at this level, that you come at it from all directions. And it's been very helpful to have partners that are able to kind of rally the troops, if you will, around the homeless issue.
Okay, Anna, how are we doing from questions?
We have a couple questions. So one of these questions is for Sharon, and maybe also you, Lisa. And this person would like to know about how the Affordable Care Act is going to influence the money available for housing in California, and whether it's supportive or not.
California, it has fully embraced the Affordable Care Act. So I think the biggest way it's influenced SB 391 is that when amendments were taken several months ago, as I laid out some of the amendments that were taken, one of the biggest pieces of the strategic plan that the state must come up with, in the amendments it says that the state must come up with a 5-year strategic plan on how to use the money. One of the biggest pieces of the amendments that talks about that strategic plan mentions the Affordable Care Act and efforts to make sure that the Affordable Care Act resources are aligned with housing that's being developed as a result of SB 391. So I think that's probably the biggest way that the Affordable Care Act has influenced the bill. But I also think that other legislative and policy work that CSH and many other organizations in California have been doing will tie in nicely with SB 391, because some of the work that we've been trying to accomplish in California is to tap into Affordable Care Act resources to fund services and housing, and also through our Policy Academy to have ongoing conversations with our Department of Healthcare Services on how we can use Medi-Cal expansion to fund services and housing, and to get people who are living in supportive housing or who are still homeless connected to Medi-Cal, which is our Medicaid program in California.
And Sharon, do you want to say something about health homes in California?
Sure. So the legislation, I think I mentioned at the beginning of my PowerPoint, that one of the pieces of legislation we were successful in passing and getting signed this year will tap into an Affordable Care Act option called health homes for enrollees with chronic conditions. And that benefit is for Medicaid beneficiaries who have at least one serious mental illness or 2 chronic conditions, chronic health conditions. And excuse me, it will fund a lot of services that have typically been funded in supportive housing, like intensive case management, hospital discharge planning, and other types of services that supportive housing has been providing for years. So our hope is that that bill will lead to funding services, to a sustainable source of funding for services in supportive housing. It requires the state, if it does tap into the health home option, it requires the state to target people who are chronically homeless and people who have been frequent hospital users. So those overlapping populations will be able to take advantage of funding under the health home option for services in housing.
And I bring that up because I think it's important. The health home option in Medicaid, which came through the Affordable Care Act, is something every state can do, whether they expand their Medicaid population or not under the ACA. And very much at the Alliance consider it to be a part of a strategy for service capacity for supportive housing, and really encourage advocates in every state, again, independent of anything else that's going on about the ACA. It's 7 or 8 or 9 states have already designed health homes and moved forward with them, and there's really no reason you can't have 50 states with health homes that support residents in supportive housing in very cost-effective and high-quality ways.
Right, and it doesn't always require legislation. Some states have done it through their administration. They haven't had legislation enacting that option. So I agree with Lisa, but would also say it doesn't always require legislation in California. Our Medi-Cal program just happens to be that our state wants us to do authorizing legislation for every type of benefit that's out there.
Great, thank you. I have a question for Kathy. Could you just clarify how much of ESG is dedicated to prevention? I believe you said 22%. And also if you could talk a little bit about how the prevention program is targeted and how the decision was made to dedicate that amount of funding to prevention.
Sure. I did say 22% of the ESG funding is targeted to prevention, and actually that was all through a competitive application process, so it was not a decision on our part, on DHCD's part. We did not set aside a specific amount. It was all part of the competitive application process where we prioritized rapid rehousing and prevention, but also funding shelter ops to ensure that there is a safety net of services. We also have state prevention money, and we have over the years that program has morphed to, it started out years ago probably being less of a homelessness prevention program and more of a financial assistance program. But after HPRP, we have moved that where we really focus on diversion and trying to target those who are most likely to become homeless. I mean, we all know that prevention's sort of tricky because you don't really know who's going to become homeless, but we are trying to target those who are most likely to become homeless. Did that answer your question, Anna?
Yes, that's great. And I just want to let people know we still have a few minutes, so if you have other questions, please do feel free to type them in. I have one more question for our folks in Virginia, and someone would like to know if a similar housing trust fund is on the table in Virginia, and if so, what would that look like?
We do have a trust fund. The trust fund was actually added in FY13, but not funded until FY14. So this is the first year that we have had funding for it. It is $8 million, and of that $8 million, 20% of it can go for homeless efforts. And so we are just getting that money out on the street right now, and we have approximately $923,000 that was awarded for the grant reduction program, homelessness reduction program, which is that piece of it. And those projects are for rapid rehousing, supportive services, or pre-development, permanent supportive housing pre-development.
Those are the questions I see at the moment.
Okay, well, we're about out of time, so I think this would be a good time to close. I want to thank our speakers, Sharon and Pam and Kathy, and also all of you listening. If you're interested in learning more about the Alliance's state policy work, please visit the advocacy section on our website, endhomelessness.org. There you will find talking points and other materials on issues like Medicaid health homes and using TANF for rapid rehousing, something we didn't talk about today, as well as recording of this webinar and the presentations in a day or two. And today we are posting a new resource I want to let you know about. It is a state advocacy guide, which supplements our advocacy toolkit. And the state guide will walk you through advocacy planning and strategy in a state environment, offers a number of tools to help you and your coalition partners decide how and where to engage in state policy processes. Your interest and continued feedback are the core of our state policy strategies, and I look forward to hearing what you're doing and what you're hearing and how we can be of help in your efforts. Thank you very much.